Good day, everybody, and happy Sabbath to you all. My name is Setsiba, and today we're discussing cardiovascular disease. So, cardio for heart and vascular for blood vessels, so your veins and your arteries. So, we'll be discussing the causes of about 8 different types of cardiovascular diseases. So, we're trying to be very brief and short. So, I hope you'll keep up with me. So the first one we'll be discussing is acute coronary syndrome. So this is all your heart attacks and your heart pains and so forth. And this happens when in your blood vessels, so your veins and your arteries, but mainly the arteries that supply blood to your heart, when they are blocked, then you will have your heart attack or your chest pain. And the causes of these, not really known, but risk factors, yes, we do know them. And the risk factors are divided into things you can change and things you can't change. So here we go. So the risk factors that you cannot change are your age. So the older you are, the more likely you are to develop a heart attack or angina. And the sex also, so gender. So females are more prone to develop this disease than males are. Family history. So if in your family you have a history of people saying, maybe your mom or your dad or your grandfather or your grandmother says, I once had a heart attack or I once had problem with chest pain, then you are most likely to also suffer from that. Changeable risk factors are, for example, your diet. So if you have a high cholesterol diet, so a diet that's rich in fats and also that's rich in salt, then you're most likely to develop cardiovascular disease. If you are obese, so if you're very big and you're not planning on losing weight, then you're also at risk of developing this. If you are a smoker, your chances are also increased. If you don't exercise, if you just sit all day, watch TV and eat, and that's all you do, then your chances are also increased. If you have high levels of stress, persistent high levels of stress, it increases your chances too. And also if you use drugs like cocaine, then your chances of having a heart attack are increased. The next we'll be talking about is peripheral artery disease. So in this instance, the blockage we're talking about will not be in your heart, but will be in the arteries, meaning the blood vessels that supply blood to the rest of your body. So if you have a blockage there, then we call it peripheral disease, or sometimes it's not a total blockage but half a blockage, which decreases the supply of oxygen that your body is getting. So also those things that we discussed, like the age, which is not changeable, the gender, like being female, which is not changeable, your family history, which is not changeable, those are also risk factors. And the changeable things we discussed, like smoking, obesity, sedentary lifestyle, using drugs like cocaine and so forth. Another disease we'll be discussing is aortic disease. So we have 2 types. So we have your aortic dissection and your aortic aneurysm. So dissection, the aorta is one of the biggest vessels that takes blood from the heart to the rest of your body, and it's made up of 3 layers. And so a dissection is if one of these 3 layers is torn and blood goes in between these layers. So if you have the 3 layers and say this one has a little tear, then blood goes between this first one and the second one, and that is what we call a dissection. And the risk factors for developing this aortic dissection: uncontrolled high blood pressure. So if you're hypertensive, so if you have high blood pressure and you're not taking your treatment properly, or the treatment you're given is not really controlling your blood pressure, then you're at risk of this. If you have atherosclerosis, which is like the blockages in your blood vessels, mainly in your aorta, then you will most likely develop this. If you have a pre-existing aneurysm, if you have any valve defect, aortic valve defects, and if you have coarctation of the aorta, there's like thinning or slimming down of your aorta, then you will most likely develop aortic dissection. Another type of aortic disease is your aneurysm. So your aneurysm is if your aortic valve, your aortic vessel, if it hardens up, hardens and weakens at the same time, and it expands. So the likelihood of developing this is if you have atherosclerosis, and we already discussed it. It's like having a plaque or blockage in your blood vessels. And so if, like the previous section we said, uncontrolled blood pressures, if you have a family history of an aneurysm, if you're a smoker, and if you've got high cholesterol levels and a high cholesterol diet, then you're more likely to develop aortic diseases. So the next one we'll be talking about is cardiomyopathies. So the cardio is for heart, myo is for your muscle, because the heart is a muscle, and pathy as in an anomaly or a disease. So we have different types. So it can be hypertrophic, can be dilated, or restrictive. So basically hypertrophic meaning that your muscle, your heart muscle, has thickened or become thicker, so you have less blood filling in the heart to deliver to the rest of your body. And dilated meaning that your muscle is now weaker, and the chambers in your heart, as in the compartments in your heart, are wider, and your heart is not pumping sufficient blood to the rest of your body. So here we have a variety of things that could cause cardiomyopathies. So it could be, one, cancers can be part of it. Two, you could have, it could be because you've had a viral infection before, and so it's weakened your muscles of the heart. Two, drugs. Three, postpartum thyrotoxicosis. If you have had a really high level of alcohol use, like over a long period of time, that affects your liver and eventually also your heart. If you have also connective tissue diseases, if you have autoimmune diseases, if you've had sometimes genetics, if in your family it's happened to someone close in your family, then you're most likely also at risk of having it. And sometimes the cause is just not known. And another thing we'll be discussing is pericarditis. So the heart has like a sac covering it, and this sac has two layers. So one is attached onto the heart, and the other one is just covering the heart. And in between these two layers, you have fluid. So as the heart pumps, this fluid makes sure that these two layers don't rub up against each other. So anything that makes any of these two layers to swell up or to be inflamed will cause the space in between the two layers to be decreased. And so when the heart pumps, then there is friction because these two layers are rubbing up against each other, and this friction will cause the pain. So anything that can cause the inflammation or the swelling up of the two layers. So you could have a viral infection that could cause this. It could be after maybe a heart attack, which is a myocardial infarction. It could be after heart surgery. So when they cut up these sections, the inflammation, the healing, all of that could be part of the cause. If you've had chronic kidney diseases, if you've had cancer or radiation to the chest, or cancers maybe from the lungs or any organ in the chest, if you have any connective tissue diseases, and hypothyroidism, which is maybe your thyroid gland not working properly, working suboptimally, and so you could have that. Another thing is if you've had rheumatic fever before, so if you've had an infection, for example, a throat infection caused by Streptococcus pyogenes, or if maybe you had a skin lesion or abscess, whatever with strep, then it could cause rheumatic fever and inflammation of your pericardium, and other types of infection also besides. Okay, and the next one is valvulopathies. So the heart is a muscle that has 4 chambers, so like 4 rooms or 4 compartments inside. I tried to draw a heart for you. Here it is. So here's the heart, and imagine it's divided into 4 rooms. So blood comes from the rest of your body and then goes into the one apartment, and then from that apartment it goes to the apartment that takes this blood to your lungs to get oxygen, and from that going into the lungs it gets oxygen, and when it's gotten oxygen it goes back into the heart with blood that has oxygen, and then from there it goes out your body or out your heart to the rest of your body to give your body blood that has oxygen, and the cycle goes on and on and on. And these 4 compartments with the different blood vessels that take the blood where it goes have like sliding doors or valves that open and close as the blood flows, so that blood doesn't flow in the opposite direction but flows in one direction. And these valves sometimes get inflamed, or let's just rather say sometimes these valves, they don't close properly and sometimes they don't open properly, and this causes a problem in the flow of blood in and out of your heart. And so this valvulopathies or valve diseases or sliding door diseases are caused when, for example, you've had an infection and this infection causes the valves or the sliding doors to be thickened or inflamed. Sometimes if you've had a heart attack before this and your valves become inflamed or swollen up and so forth, or sometimes they become flaccid and they don't work properly, so say they don't close properly anymore, so now blood, instead of being closed and not moving back, blood flows back. Sometimes people are born with this, so they will have valves that don't work properly or that are absent and things like that. And the next one is congenital heart diseases. So here mostly, so when the person is developing inside their mother's wombs, sometimes the heart doesn't develop like it should, and so the compartments I was telling you about, sometimes the walls in between the compartments does not close and is left open, and sometimes the heart stays in the form of like the embryonic phase of the baby. So before the baby's a baby that you can see with the hands and the legs and the head and everything, the heart stays in that shape, and when the person is born, that heart isn't functional for a human being that has hands, legs, and a heart and brains and so forth. And the last thing we'll be talking about is heart failure. Now, heart failure is the very end stage of cardiovascular disease. Now, heart failure is when now your heart can no longer take and give blood to supply the demands of your body. So when you're at this stage, it's because all the other diseases I've mentioned before were, one, either not treated appropriately or accordingly, or two, the diseases were treated, but with time even treatment couldn't help anymore. So this heart failure will have, say for example, hypertensives who have not been controlling their blood pressures for a long time, or sometimes people who've had high blood pressure, but after many years now the heart gives in to the high blood pressure. Sometimes, for example, the diabetes, and for example, all of them, the diabetes, the valvulopathies we discussed, the cardiomyopathies we've discussed, the pericarditis, the acute coronary diseases. So this with time, sometimes in the end, it could lead to heart failure. And so heart failure can be right or left, or it can be both, where now you have blood not flowing where it should be flowing and there's a backflow. And so, for example, there could be a backflow into your lungs, and then it's like you're choking on your own blood, or backflow into the rest of your body, your liver, and the vessels that supply all the organs in your abdomen and the rest of your body. Or sometimes you could have lung diseases that cause this congestion of blood and so forth. So heart failure is the very last thing that happens when all of the other diseases were not treated, or after many years, even though they were treated, but then now the heart does not, the heart can't bear anymore, and so you say a person is in heart failure. So I think the most important thing to take away from our discussion is that some things are some risk factors for heart diseases can be reversed or they can be prevented, and some can't be prevented. But just because you have a risk factor does not mean you will develop heart disease. It just means that your chance is more increased than another person who doesn't have this. And just one risk factor doesn't mean you will have it. It needs multiple risk factors for you to develop a heart disease.